Alright, hello, I'm Tyler Gunter, and today I'll be doing my presentation on diseases and microbes in the human body. So, I chose to do the respiratory system, and the three I wanted to focus on were M. tuberculosis, S. pneumoniae, and C. diphtheria. So to start, I just want to introduce kind of the three microbes I was going to focus on in the respiratory system. And the respiratory system basically consists of the pharynx, bronchi, and lungs. The main structure involves breathing and infection risk in clinical settings. Diphtheria is a toxic bacterial infection of the respiratory tract caused by the C. diphtheriae, preventable by vaccination but dangerous if untreated. Tuberculosis is a contagious disease caused by the bacterium M. tuberculosis, which often affects the lungs but can also spread to other parts of the body, such as the brain, kidneys, and spine. So, pneumonia is an infection of the lungs caused by the S. pneumoniae that causes inflammation and fluid or pus to fill air sacs, making breathing difficult, and it can range from mild to life-threatening depending on the cause, age, and health of the patient. So I just want to kind of give you a background on why it's important and why I chose the respiratory system itself. And the main thing is because the respiratory infections are among the most common in healthcare that we'll see. They directly impact patient safety. Sterile processing plays a critical role in preventing cross-contamination too while handling contaminated equipment. CSTs must know these microbes spread to ensure proper sterilization of respiratory instruments like bronchoscopes, endotracheal tubes, and ventilator components. Knowledge of respiratory diseases helps CSTs understand which instruments are high risk for contamination. That way, we just kind of you want to focus on everything, but really dial in on those that you know might cause a problem. So, the anatomy and physiology of the respiratory system is going to consist of the upper and lower respiratory. The upper respiratory tract consists of the nose, nasal cavity, and the pharynx, while the lower respiratory tract consists of the throat, bronchi, and lungs. The respiratory system primary function is gas exchange, which supplying oxygen and removing the carbon dioxide from the body. So the first one I want to start out was diphtheria, and that's caused by the C. diphtheriae, which is a gram-positive bacterium that we learned in previous chapters. And basically, it's going to get transmitted by the respiratory droplets, like coughing, sneezing, or close contact, especially in fortunately, infant daycares. The primary site of that is going to be in the upper respiratory tract. Like we just previously stated, it's going to be the nose, throat, or tonsils. The vaccine DTaP or TDAP is highly effective and a part of routine childhood immunization. One of the vaccines we also have to get to enter certain programs. Laboratory testing consists of the PCR testing, the polymerase chain reaction, which is a test that detects genetic material from a pathogen or abnormal cell sample. And another laboratory test is the ELIC test, which involves a test strip of filter paper containing the diphtheria antitoxin, and it's placed on the center of an agar plate and checked for it. And some symptoms of that is going to be sore throat, swollen glands in the neck, a barking cough, a racing heart, wheezing or difficulty breathing, and fevers and chills. So a diagnosis is going to be made by clinical suspicion. Basically, they're going to look for any presence of sore throat, fever, or gray pseudomembrane covering the tonsils or throat. A culture is going to be taken by the throat swabs and then plated to isolate that toxin, C. diphtheria. The bacterium colonizes the throat and the upper respiratory tract, which really is going to make it take over and cause those problems. The vaccination remains the most effective preventative measure, and that's also one we get while we're younger. In the picture, you'll see antitoxin being administered to a patient. So some complications from that are going to be the toxic exchange that's going to damage the heart, nerves, and kidneys. Treatments like antibiotics such as penicillin, erythromycin are used to kill the C. diphtheriae and stop the transmission. Patients are kept in isolation to prevent the spread until cultures or confirm eradication. Like you said, it's highly contagious. Prognosis with early treatment. Most patients recover. Can take a few weeks, though it's highly likely they'll get okay. However, without treatment, the mortality rates can reach 5 to 10% and up to 20 in young children or older adults. Procedures like the tracheostomy or airway suctioning require sterile instruments. Improper sterilization can spread diphtheria or other respiratory pathogens, which is why it's critical for CSTs to look for that, know what it is, know where it comes from, and how to sterilize it properly for future surgeries. And an interesting fact I found along the way was, according to the Southeast Express, the Great Race of Mercy in 1925 had sled dogs carrying the diphtheria antitoxin across Alaska to save Nome during an outbreak, inspiring the famous Iditarod race. The next one I wanted to touch on was tuberculosis, which is caused by the M. tuberculosis. And it is an acid-fast bacillus. The transmission is spread via airborne droplets when an infected person coughs, sneezes, or speaks. Anybody that's played video games knows that there has been a few storylines where there has been that transmission through some fighting and then they spit blood onto them, and we've seen how that takes over on its own. And TB can remain latent or progress to active disease, damaging lung tissue and sometimes spreading to other organs. Diagnosis and lab testing will contain the tuberculin skin test, the TST or Mantle test. Small amounts of purified protein derivative is injected under the skin, and then the site is checked after 48 to 72 hours for swelling, indicating prior exposure. And those of you in the sterile processing program know we also had to get that vaccine, or a test, not vaccine. Diagnosis, and another one is they'll do chest x-rays and CT scans that'll show any lung lesions, cavities, or any infiltration of that tuberculosis. And the treatment is very treatable, but it requires a course of multiple antibiotics taken exactly as prescribed. The treatment differs depending on whether the infection is latent or active. Latent tuberculosis, according to CDC, is ionized daily for 6 to 9 months. Rifapin daily for 4 months. The isoniazid for plus the rifapentine once weekly for 3 months. The duration 3 to 9 months, depending on the plan, the course of action your doctor describes to go. Active tuberculosis, the first line of drugs is going to be the isoniazid and the rifamycin and the pyrazinamide and the ethambutol. Active tuberculosis treatment typically takes 6 months, the intensive phase 2 months with all 4 drugs, and then the continuation phase with takes 4 months with the first 2 drugs. The prognosis for latent TB is most people with latent TB remain asymptomatic and never develop active disease, which preventative therapy prognosis is excellent. The prognosis for active TB with proper treatment with 6 to 9 months of multi-drug therapy, those cure rates are high. According to the CDC, 85 to 90%. Without treatment, TB can be fatal. Historically, mortality rates exceed 50%. And CSTs must understand TB's resilience, that Mycobacterium tuberculosis can survive on surfaces for long periods of time if not properly disinfected. The proper decontamination of respiratory instruments such as bronchoscopes and suction devices is critical. That way, any future surgeries that do occur with those instruments won't have any cross-contamination. Interestingly enough, it is safe to kiss someone with tuberculosis and not contract the disease, as it is not a touch-based infection. It has to be through those droplets, like we said. Now the last one I want to touch on was pneumonia, and that's going to be the S. pneumoniae bacterium. And some other bacterial agents include the Haemophilus influenzae and the Mycoplasma pneumoniae, in which are gram-positive, alpha hemolytic, and encapsulated diplococcus. I think I'm saying that right. And which we learned about in previous chapters. The culture with the sample is plated on an agar plate and incubated to grow colonies of that S. pneumonia to basically confirm diagnosis, which would be a gram stain culture, which would show a gram positive in the sputum or blood. Viruses caused by this can be influenza virus, the RSV, and COVID-19. An interesting fact I found too is pneumonia is the world's leading cause of death among children under 5 years of age, accounting for 16% of all deaths in children under 5-year-old, killing approximately 2,400 children a day in 2015. And I referenced Harvard right there for that stat. The treatment for bacteria pneumonia would be treated with antibiotics such as amoxicillin, azithromycin, and ceftriaxone. Treatment for viral pneumonia would be managed supportive care, which would be rest, fluids, fever, and any reducers you could take along the way, such as like maybe ibuprofen. Antivirals may be used for influenza or COVID-19. The prognosis with a prompt diagnosis and appropriate treatment, most patients recover fully within 1 to 3 weeks. Any CSTs must apply strict sterilization protocols for cleaning, disinfection, and while autoclaving to prevent those hospital-acquired pneumonia, which those hospital-associated infections we learned about. So in conclusion, I just want to go over what we went and the 3 things that I focused on, which in the respiratory system, which would be that C. diphtheria, the M. tuberculosis, and S. pneumonia. And those all are examples of way microbes can invade the respiratory tract and disrupt vital processes like oxygen exchange, which directly lead to the diphtheria, tuberculosis, and pneumonia. And here's my reference page, and done.